And let me tell you, what gave us more confidence was partnership with certain organizations. And one such organization is HIMSS, which is Healthcare Info and Management System. They actually work with the hospital in driving these technologies and in IT technologies with the hospitals. They worked hand in hand with us during this journey and brought in all the right partners. And even during the phase of this whole challenge and selecting solutions, they played a very instrumental role. So we have pleasure of having the president of HIMSS today with us, Mr. Jeyaselan Jeyaraj. Welcome to you, Jaya, and over to you to tell us about what your organization is doing and what you think about the process that we have started and how we can take it forward and scaling it as Devjani was saying, how do we take it to next level? So we'd like to hear your views on it, you being a very close partner in this.
Yeah. Thank you, Sanjeev. Good afternoon. It's a great pleasure to interact with all of you. Thanks to NASSCAM for organizing this wonderful forum and really bringing this very important initiative for the country. So I'm just going to talk a little bit about what is happening from healthcare transformation, what are the key trends, what is HIMSS, kind of how we see this whole space kind of evolving. So none of us would have ever lived through time like this, right? A devastating pandemic. It sickened more than 90 million people around the world. It caused almost like 2 million deaths. It disrupted lives, almost everyone on the planet, the way we never would have imagined in the past. So for a region that has made great progress in improving health of its citizens for the past 20 years, thanks to a large part of its educated, skilled workforce in India, a vibrant startup community nurtured by an organizations like NASSCAM, there's a great potential to move forward quickly to develop new models of care. The timing could not have been worse, right? So healthcare in India is going through a major transformation. Traditionally, we see healthcare as a laggard when it comes to IT adoption compared to financial or manufacturing or retail or other industries per se. But then COVID-19 brought in interesting change. Like many health systems are forced to switch to digital regarding their consultations, their patient outreach initiatives. It has been a tremendous increase in the use of digital health solutions, including telehealth, electronic health records, digital devices, population health databases, analytical tools, along with changes in regulatory environment as well to support the country to move forward. One of them is, for example, like telemedicine practice guidelines that really opened up very good clarity for providers to look at telehealth and really use that in a very difficult time like COVID-19. And the government also released like National Digital Health Blueprint, which really kind of give the foundation for everyone to really adopt. At the same time, I would also say that the pandemic also exposed the vulnerabilities in our health system in terms of our own preparedness, our ability to respond to challenges, the supply chain. If you look at most of the hospitals in India, we have very basic clinical information system, right? And we capture very little clinical data, largely, patient information, demographics and billing and a little bit of clinical data. And most of our source systems, whether it's clinical or financial or operational, they're all largely isolated. So there is really a challenging effort to move the needle to initiatives like population health management. So where do we go from here? I think let's look at first the hospital point of view. The important challenge that we need to address is the healthcare data interoperability. This has been a challenge for our country for quite some time. It is important that we create a nice backend systems that can easily collect and analyze clinical data of public health information and make it available to really make informed decisions. And interoperability makes the data more accessible. We all need to work together to address the technical and regulatory limitations that could impede the flow of information while protecting the patient's security and personal health information. If you look at Government of India, they've adopted SNOMED CT as a standard. They made it available for free for use for the hospitals to really adopt. But if you look at how many hospitals really adopted, SNOMED CT or the interoperability standards like FHIR, there is very little. So really, we have a long way to go. So it's important that we integrate our health systems through a national exchanges like NDHM, National Digital Health Mission, both at the national as well as at the state level as well. So the real success of interoperability will achieve only when we have the access to patients' longitudinal health record. The patient can access their health record irrespective of which hospital they go. So that's the kind of milestone that, and clearly that is where NDHM also is kind of moving forward. I also talked about the clinical systems, whether clinical or operational or financial. There are all largely isolated systems. So important that we implement clinical data warehouse systems at the health system level, create a single source of truth to really address the complex challenges. Now, if you look at COVID, also brought in another dynamics in terms of genomics, because at the end of the day, it's a mutation. So, I mean, we do have a national genomics biobank, but it's very primitive stage. I think we have a long way to go. The CSIR has set up something like a whole genome sequencing for 1,000 Indians. There's a project that they have kind of set up, but it has to go beyond the pilot to really provide a infrastructure to kind of store the genome data for the population across the country. Now, the other challenge I want to kind of call out is the easing the burden of clinicians. It's very important, especially situations like COVID. The frontline care providers put themselves at greater risk while undergoing some of the important circumstances, right? So they are the true heroes of the coronavirus crisis, I would really say. How do we really provide them much more digital health tools, which will really kind of make their job simpler? That's something that we really need to look at. The other perspective I want to also talk about was disease surveillance. Now, we do have a program in India called IDSP, Integrated Disease Surveillance Program, but that has to be augmented with a technology-based real-time surveillance. I mean, today, right now, what we have is a very passive set of monitoring where we collect data through a structured forms that comes like a weekly-based data. But this kind of approach is no longer sustainable given the larger population that we have and the disease outbreaks like COVID-19. So how do we really enable hospitals to send data from the clinical encounters directly to the IDSP? So I think the challenge, healthcare innovation challenge, there are a lot of topics we talked about. So this is also something that I kind of want to share to the team. And how do we really rethink the way how we currently monitor our diseases, outbreaks? How do we really use automated, how do we classify syndrome categories automatically, right? Using techniques like multivariate statistical detection algorithms, using AI and NLP kind of mechanisms to really identify the anomalous patterns in the syndrome counts in real time. So these are really the key things that we would really need to kind of think through. And lastly, the disproportionate impact of the COVID on vulnerable communities. It's also highlighted the importance of social determinants of health, particularly the unequal access to healthcare. So that's where the digital health solutions can offer important opportunities to pinpoint. So what are the systematic problems that can reinforce inequities? And how do we really going to address that is really, really important. So this has been a time of unprecedented disruption, stress and suffering in India. But I genuinely believe we will emerge stronger as we move forward and take advantage of the remarkable digital transformation of healthcare that's underway. Thanks to organizations like NASCOM, really to make healthcare across India more effective, more accessible, affordable, and more equitable. Yeah, thank you. Thank you for this wonderful opportunity.
Thank you, Jaya. And thank you for this partnership. And together, I believe, given that the understanding you have with the hospitals, we can work on some of the data-related challenges that you talked about, some of the other issues that you brought about. I think I have full confidence looking at the teams that the way we work together. I think I see a good journey ahead. So thank you for your time and thank you being here. Next, we would like to hear from the people who actually deliver the treatment to the patients. I mean, we in the technology world can do anything that we can say anything we want. Ultimately, the last call is taken by the doctor. And we are so pleased to have Dr. Vineet Talwar with us today. He not only heads the medical side of oncology in one of the prestigious Rajiv Gandhi Cancer Institute in Delhi, but he also heads the digital initiatives in the hospital. And first of all, I'd like to congratulate your hospital being a public hospital to be part of this challenge. Normally we don't see hospitals of that size and public hospitals coming and taking part in it. And you being a practicing doctor also, heading such an important medical division there. So Dr. Talwar, please share with us, first of all, what you think of this and what more we can achieve, and your experiences on the digital journey, good things that happened and not so good things that happened, So over to you, Dr. Talwar, and welcome.
Thank you so much. And at the outset, I would like to thank NASSCOM for giving me such an opportunity to delve with such an august gathering who are masters in their fields. So I would be giving the perspective from a physician's point of view, as you rightly said. So can I have my slides, please? Can you put it in the, yeah. So the next slide, please. How digital health technologies have impacted all of us, that the less said, the more it is. Whether it is mobility, whether it is social media, whether it is analytics, cloud computing, artificial intelligence, machine learning, blockchain technology, robotic process automation, you name it and you have it. It has a profound impact. Next slide, please. But as a physician and being in the medical field, the dealing with human beings is a very, very different ballgame altogether. They have their unique problems in healthcare, meaning thereby, unlike a commodity, each human being is different. And error in a human being, or error which can cause irreparable damage, is not acceptable. Health information, of course, is precious. It has to be protected. Unlike the other issues, you should have a detailed history, whether the past, whether the present, for that, so that you can digest it and take it to the future. So the past information for the continuity is a must. And so are the hackers nowadays, who are smelling health data more strongly than anybody else. The little said, the better. Standardization, as my previous speaker told, is missing. There is no established framework for clinical documentation. If you go from tier 1 to tier 2 to tier 3 cities, you find that the level of automation and the standardization is woefully inadequate. And to couple it up, the government regulations are stringent worldwide, and even here they're becoming more and more stringent as more and more problems are coming up. And along with that, there are a number of soft issues: communicating bad news, affordability, how to continue treatment, what is the intent of treatment, so on and so forth. So these things, next slide please, are very, very unique to our healthcare system. When we look at the ground reality, if we see from the patient's perspective, what is the patient looking for? The patient is looking for safety. Next. By safety, what does he mean? Safety, he means standardization of treatment. And of course, he looks at the outcome, whether the treatment is curative or the treatment is palliative. The experience of the patient, the quality of life issues which are assessed whenever you treat a patient. You go back 20 years, the QLs, the quality of life indices, were next to abysmal. And now you find that they hold a very, very important position whenever you are treating the patient, or whenever you are thinking of the paradigm of management in the care of the patient. And last but not the least, the cost. India being a very price sensitive market, where a very, very small percent of patients are under the insurance. These are very, very important issues whenever you start the treatment, because it acts as a very big prognostic index. That is the financial prognostic index whenever you treat these patients. Next slide, please. So if you go along with them one by one, when you say standardization of treatment, a lot of things which have been done by us: barcoding the patient identification, barcoding of the collection sampling, of the medication administration record, the online patient vitals recording, alerts, pop-ups, drug-to-drug interactions, wearable devices, and automation along with that. The next slide, please. So coming to the intent of therapy, that is curative versus palliative, the treating doctor automatically is alerted on the critical result. There is digital pathology, there is PACS, picture archival and communication systems. All of these we have at our center, fortunately, electronic health records, mobile-based workflow, reducing myriad of papers, and of course, the latest, which is personalized medicine and targeted therapies. The next slide, please. When we talk of quality of life indices from the patient's perspective, as I had mentioned earlier, there are various things which are being done to improve that. And some of them are the internet and the social media, which contains information about the treatment options. You can have online appointments, you can have interactions between patient and hospital even before the visit, which was not there prior. Mobile apps, which are helping the patients, alerts on regular medication and periodic tests. You have online diagnostic reports, and of course, the customer relationship management system, helping personalized response, that is CRM, which is the latest thing, latest kid on the block. Next slide, please. How does the digital technology improve the affordability? One is, of course, telemedicine, where you cannot reach the patient. You can always guide the patient. You can have remote preliminary consult, online delivery of lab and imaging reports, paperless workflows, they reduce the costs, and the AOLS, that is the average length of stay. So the endeavor is always there to reduce the length of stay of these patients in these hospitals. There is an endeavor to increase the patient education, preventing frequent hospital visits, which is being the keystone when we have been through this pandemic. Wherever there are unnecessary visits, we tell the patients and we advise them through telemedicine or through WhatsApp or whichever the media might be, which the patient is conversant with. And of course, initially, which TPA was there, there is online TPA and insurance interface, which is occurring now, so that the movement is very, very fluid. There are gadgets which are improving the lifestyles and critical conditions, and they can give the patients the idea, next slide please, as to how the things are going to come out. So artificial intelligence is playing a very, very big role. And it is the ability to imitate the human cognitive behavior, whether it is machine learning, deep learning, or data acquisition through the bots. You can have background data processing. I'm sure all of you are very, very well versed with this. For me, it's a big learning curve, and I'm still learning. And it is becoming more and more astounding as you come through the nitty-gritties of AI and how these things work. And it is very, very impressive. And I think this is going to be the thing of the next Vista. Next slide, please. So as you know, it has three components: machine learning, deep learning, and data science. Next slide, please. It is making a lot of forays into the medical health system, whether it is imaging, whether it is translational oncology, clinical decision making, whether it is acceleration of drug discoveries, where you have a high throughput analysis, detecting effective drug discovery deliveries systems, or personalized medicine, where you have a lot of immunotherapies, targeted therapies, so on and so forth. So it is making a foray wherever you need a high throughput analysis, wherever you need a quick decision, and of course, an incisive and statistically significant answer. So it improves our reasoning, it helps through it, and it makes our decision making, the sensitivity and specificity much better. Next slide, please. So when you look at artificial intelligence, next slide, please, where it has actually helped us, it is used to build combination therapies, that is targeted therapy with immunotherapy, or targeted therapy with chemotherapy or radiotherapy or surgery, you name it. And the sky is all full with all these. And next slide, please. And that is how we find that this is one example, that is the Curate AI, which is a phenotypic precision medicine platform, which has been clinically validated and used to prospectively optimize patient liver transplant, immunosuppression, and tuberculosis therapy. This is just to name one example. And based on this, there are a huge vista which has opened up, which has really helped us a lot as medical physicians. Next slide, please. And this is, a very crude representation how it is helping us in our daily clinical practice. You find that there's a group of people, but when you see, actually, all of them are heterogeneous. None of them is conforming to one scale of treatment. And with the help of artificial intelligence, we are able to sift out which patient is for which patient is for which kind of therapy, whether it is radiation, chemo, immunotherapy, or targeted therapy, which would best suit this person, which in layman terms, we call it as a tailor-made therapy. So it might look very simple, but when you go into the depth, tailor-made therapy requires a lot effort. And that effort to a certain extent is shouldered by the artificial intelligence. Next slide, please. So when you have this, when you have the automation with you, you have layers of healthcare services, the outermost being the remote touch points, the remote monitoring of those patients who are cold patients, then including the patient services, how to fluidly interface the human and the digital platforms and get the maximum benefit out of it. When it comes to diagnostics, I told you we have AIs which are working in pathology, in radiology, everywhere they are having and they are helping us a lot to quicken the results and to make it more sensitive and specific. And of course, in the treatment planning, they are helping us in finding out which are the exact standards of care. Next slide, please. Next slide, please. You have the remote touch points. You have the voice-enabled chatbots where you use the AI. Bots are integrated with the website. And for instance, basic questions like OPD timings, unanswered questions responded by humans. The bots continuously learn from human interventions. You can have call center supports also where the human interface is there. Then the bots can sit over the call center software and incoming calls. They are attended, multilingual support, answering routine questions. And they can take off the bulk of the problems which have been told by the previous speaker. So this is where they can actively get involved in our treatment paradigm. Next slide, please. Next slide, please. So that all translates into efficiency and quick service without a drop in the standardized treatment or without a drop in the quality, whether it is quality of treatment or whether it is quality of indices of the patients. So you have a connected healthcare and a fluid interface where the bots can gather information, they can gather the turnaround time at every touch point, and that when it can be analyzed later can use to spruce up the system or check out where the problems are and they can be taken care of. There can be a smart workflow management and any outliers which are there can be quickly identified and taken care of. Next slide, please. Next slide, please. So I think I'll stop here. Can you go one slide back? So I will stop with a quote of Diane. The next slide, please. Sorry. Yeah. So the quote by Diane Ackerman that artificial intelligence is growing up fast, or rather I should say very fast, as are the robots whose facial expression can elicit empathy and make your mirror neurons quiver. So I think I'll stop at this point. I thank you for your patient hearing.
Thank you, Dr. Talwar. I think this is the first most technical presentation I have seen from a physician, and you are giving us a run for our own money. The amount of technology that you have put in your slides there. So no, thank you so much. And obviously, I think some of the details you mentioned, how deep it has gone. While we know a lot of things, which we hear about and see, but what you talked about. Liver transplant and things like that, I think is definitely we'll want to know more about. I think it's very refreshing to hear it from people who are on the ground actually administering healthcare there, to the patients. So thank you so much for your time and being here, Dr. Talwar, and we'll continue this discussion with you.
Thank you so much. Yeah, it's my pleasure.
So next, I just want to give a little background of this COE. I didn't say that in the beginning. The COE concept was conceptualized in MeitY. MeitY being, for those who don't know, MeitY is Ministry of Electronics and IT. A very important ministry in today's times, given the digital India, and the digital is a focus for the entire world, not just for India. And MeitY is sitting right at the center point for the digital journey for India, and we have come a long way, and I think accelerating further. We started out with one center in Bangalore way back, and then seen there's some progress and success out of that. We opened a second center in Gurgaon, and then two more after that. And when we opened in Gurgaon and Heartron 2-3 years ago, we were saying we are not sure how many people will come there. We opened a lab, people will occupy that or not. I'm happy to report, we covered that journey very quickly there. In year and a half's time, that facility was full and there's a demand for more, and we are looking at expanding and are talking to Heartron for supporting us with more space. That was the level which, the demand and the number of entrepreneurs that are growing in the country, and also Gurgaon being one of the hub, or I would say NCR being the second biggest hub in the country after Bangalore for entrepreneurs and the technology companies' presence there. So having started with creating a lab and having entrepreneurs work out of there, we have come a long way into where we help the entrepreneurs with what they need and developing the solutions and coming out with the product, be it funding, be it mentoring, be it connecting, to the level that when the product's complete, how do we take them into real world? That's another big disconnect that needs to be bridged by someone. And the program we are talking about today is part of that effort. On the one hand, we help the entrepreneurs come up in our labs. On the other hand, we see how we take solutions to actually take or impact some of the sectors with the digital innovation. And the good news is, we are pretty much, I would say, if not ahead, we are almost there with the rest of the world when it comes to innovation. I sit with the entrepreneurs day in, day out, and I have seen this thing maturing over the last 3-4 years. So with that, I'd like to first of all thank MeitY for the vision that has been shown by MeitY, and also the state governments who have been participating in it, and the industry who has been an equal partner in this.